Hello, everybody. This is Dr. Bob DeMaria with another episode of Ask Dr. Bob from Westlake, Ohio and Naples, Florida. Dr. Bob, my eye doctor said I have cataract in both eyes and I need surgery. I have my first appointment on August the 12th. Is there something I can do to prevent that surgery? Well, I wrote a book on preventing surgery, and in it, I have a chapter on the cataract. Now, what I have learned over time, that you have to look at the calcium-phosphorus ratio. Traditionally, you should have 10 parts calcium, 4 parts phosphorus. If your calcium-phosphorus ratio is weighted on the calcium side, you have a potential to have cataracts, kidney stones, arthritis, and tartar in your teeth. I would suggest that you would go to our website, schedule a consultation after you have the OptiChem profile, and I'd be able to help you decide what you might need to do. Now, I'm not going to tell you it's going to go away in 2 or 3 months because it's a lifestyle, but if your cataracts are not causing you to have impaired vision, it's worth a try. Dr. Bob, my research indicates that I may have a urethral caruncle, and the main therapy is estrogen cream. And you wanted to know if there's a natural source of estrogen. Well, in our practice, we don't recommend estrogen per se. We focus on increasing adrenal gland function. I may consider, or you may consider, having a female hormone panel via saliva testing or a hormone panel via serum testing to see exactly what levels are going on. We use a product that supports progesterone. Progesterone can be converted to various hormones in your body. We also know that your adrenal gland function is very important. You may consider a CBC with a differential. And the reason you're doing that is you want to see if your eosinophil count is elevated, because you may have also some other issues, including unfriendly organisms in your body that have created this distress. That was a very good question, by the way. Dr. Bob, I watch you on Jonathan's cardio program, and I want to know what a good test is for heart health. And that also is a very good question because we do a test in our practice called OptiCardio Plus. It's our traditional OptiChem, but it also adds to it fibrinogen, which tells me if you have thick, pasty blood, insulin, because if insulin's elevated, you're going to have inflammation, CRP, which is the amount of inflammation potential you have in your body, also an iron panel, because if your iron levels are off, especially your ferritin, if it's high, potentially you could have literally rusty blood. Also, the traditional CBC will be a part of that, looking at the thickness of your blood. So we have this blood test that can be used literally anywhere in the United States. You could also visit at our Florida office in Naples or Ohio office to have a heart sound recorder done to see how your heart is functioning. But if you're long distance, you might consider doing the OptiCardio Plus. It'll at least give you some ideas of where your body is coming from. When one other marker on there is your A1C, which is the blood sugar test. If it's elevated, you have inflammation. Tremendous questions. Thank you. I'm Dr. Bob DeMaria.